Imagine a world where the rules for protecting your child's health change overnight, leaving you scrambling for answers. That's the reality many parents face today as they grapple with a tangled web of conflicting federal guidance on updated COVID-19 vaccines for kids. But here's where it gets tricky. The very system designed to provide clarity is now a maze of uncertainty, and the stakes couldn't be higher. Let's break this down, and yes, this is the part most people miss about how policy shifts can quietly reshape public health. For years, the process of rolling out seasonal vaccines like the flu shot was a well-oiled machine. By early fall, parents knew exactly what to expect: clear recommendations from experts, vaccines in stock at pharmacies, and insurance coverage locked in. This rhythm worked because it involved scientists, doctors, insurers, and even the public in a transparent, step-by-step dance. Chaos began in February 2025 when Robert F. Kennedy Jr. took the helm at the Department of Health and Human Services. Suddenly, the usual playbook was tossed out the window. Instead of public hearings and evidence-based reviews, decisions were made behind closed doors. In May, the FDA bypassed its own independent experts and announced that updated vaccines would only be approved for children with high-risk conditions. Meanwhile, Kennedy's team declared on social media that healthy kids no longer needed the shot. But wait, here's the twist. The CDC's guidelines still say healthy children may receive the vaccine, while the Advisory Committee on Immunization Practices, ACIP, the group that once provided trusted guidance, was disbanded and replaced with a smaller, less transparent panel. This isn't just bureaucratic drama, it's real-world confusion. Parents are left wondering, is my child eligible? Will my insurance cover it? And if the rules keep changing, who can I trust? A recent poll revealed that half of parents are unsure whether federal agencies even recommend the vaccine for healthy kids this fall. And this uncertainty comes at a dangerous time. As cases rise and schools reopen, vaccination rates for children are already lagging behind other routine vaccines. So what can parents do? Start by talking to your pediatrician. They're your best resource for weighing the benefits and risks, checking eligibility, and navigating insurance coverage. But even that isn't always enough. In some areas, vaccines are unavailable due to supply shortages, unclear policies, or providers refusing to administer them off-label, meaning outside FDA-approved guidelines. For these families, the choice has been taken out of their hands, and here's where the controversy kicks in. Should parents trust the new guidelines when the process itself is under scrutiny? Critics argue that cutting funding for mRNA vaccine research, a technology with potential beyond just COVID, could stifle medical breakthroughs. Others question whether the disbanding of ACIP undermines scientific integrity. What do you think? Is this a necessary shift towards streamlining vaccine policy, or a dangerous erosion of public trust? Share your thoughts in the comments. While the vaccine debate rages on, there are still steps parents can take to protect their kids. Keep sick children home, teach hand washing, and stay informed about local disease trends. And don't forget, routine vaccines like MMR, DTaP, and flu shots remain critical. This year, the U.S. is already seeing a surge in measles cases, the highest in decades. So staying up to date on all immunizations is more important than ever. The road ahead is murky. Guidance may continue to shift, and access to vaccines could become even more patchy. But in this fog, one thing is clear. Trusted sources like your pediatrician and organizations like the American Academy of Pediatrics will remain your best allies. They'll keep providing evidence-based advice, even as the federal landscape changes. So stay informed, ask questions, and remember, your child's health is worth the effort, no matter how complicated the path gets.